Hello and welcome everyone to our Tuesdays at 10 with Marty and Jen. I am Marty Winkler, if we have not met before. And I have been using LifeWave patches for 7 months now, loving the results. Some anti-aging things, some things that have helped me with reducing cortisol, anxiety, things like that. So anyway, I've been in the wellness space for over 10 years now. Started originally with using essential oils, eating cleaner food, whole food, less processed stuff, clean water, meaningful movement, all the things, especially once we get to a certain age, things start catching up to us, some of our lifestyle habits, etc. I also am certified body code, belief code, and emotion code practitioner. So I have been doing that work on myself for several years now. And then once I learned that I could be certified and help other people, I did that. It fits in very nicely with all the things that we are sharing with the patches, oils, food type things, things that Jen shares as well. So that's a little bit about me. I'm going to stop talking now and introduce our lovely co-host. She's a nurse. She's amazing. Her name is Jen Jordan. Jen, are you ready to take it away?
I'm ready. Yes. Most everyone here already knows me, but I am Nurse Jen Jordan, and I have the health and wellness company, Nurse Jen Jordan, under the umbrella of Sovereign Spirit Ministry. And with that, I scan people's DNA and we get to the root cause of ongoing or acute health issues. It's pretty actually amazing work. And I have been in the healthcare field for 34 years now, 34 years. And prior to starting my own business in 2021, I worked for 30 years in the clinical setting and the hospital setting in the areas of education and at the bedside, and have done multiple different types of areas of nursing. Okay, so today we are going to talk about the company LifeWave. We're going to talk about X39, its flagship patch. There are 10 patches that this company has developed and for humans, and one of them, an 11th one for veterinary medicine. Okay, so before we get going, however, it's very important that we make the disclaimer that we are not here, neither Marty nor myself, to give specific medical advice to you. If you have any specific medical concerns, it's up to you to take it back to your primary care physician. And we will, however, be able to discuss symptoms. If someone has a specific diagnosis they've been given and they want to talk about the symptoms of that, we can discuss what patches help different systems, but we're not able to diagnose or make claims for any curing of any diseases. Okay, so I just want to let you know that typically we have been starting with a video discussing what X39 is, but we're going to go ahead and skip that today because people that have been on here for multiple calls are probably getting really tired. Oh. So what does X39 do? It's a patch that reflects your body's own infrared light. We all have infrared light in our body, and that's how we can see people at night with night vision goggles. And with that, the light from our body reflects the patch that is on our skin. It's stuck on our skin like a little Band-Aid, and it signals into the body to make GHKU copper peptide. It is known that GHKU copper peptide stimulates the production of stem cells. So when we're talking about these patches, of course, my patches are over there to show you, but most everyone here is using the patches. When we're talking about the patches, this one particularly of today is X39. However, so when we say X39 stimulates GHKU copper peptide, which in turn stimulates stem cells, is actually the correct process of what's going on. What we don't do in this company is say that this patch stimulates stem cells. Okay, do you see the difference there? We got to walk that fine line, but it stimulates the peptide that makes the stem cells. Okay. So what are stem cells and what do they do? When we are born or when we're created at the point of conception, we have a ton and ton of stem cells, and that's what creates our body. Isn't that crazy? Have you ever really thought about that? So an egg and a sperm come together and then a human grows. Whew, how does that happen? Okay, well, a lot of that has to do with stem cells, and there's stem cells that knows it needs to go make a brain and a head and arms and all the things. Okay, so when we are born and in that first year of life, we have an exorbitant amount of stem cells available to help us do some exponential growing and developing. Okay, so stem cells are cells in the body that can become any cell that they want to. So if we damage something in our body, let's say there's I've had I keep always going back to the heart, but and it's some kind of heart damage, either a cardiac event or COVID like to jump into the cardiovascular system and wreak havoc with people. If there is some healing that needs to happen with the heart, those stem cells that are being generated by the X39 patch are going to go to the heart because that's what needs the biggest amount of support and regeneration in the body. Okay, so we don't have as many of these stem cells as we get older. So I'm just going to show you something right here. Okay. As we get older, let me put this down here, and you can see the difference here. At age 20, we have 1 billion healthy stem cells. That's a lot. That's why in 20, we were just like rocking it in our 20. We're like, immortal in our 20s. We could do anything. And as we get older, let's just jump up here and look at, by age 60, these stem cells have declined by 90%. That's only 40 years. And we know these days that's just a flash in the pan. Okay. And now these stem cells in our body are down to 100 million versus 1 billion. So when we injure ourselves or we we just have a procedure done, maybe someone has a knee replacement and it takes them forever to heal. That is because they don't have the amount of stem cells that they had, when they were in their 20s and 30s to help repair that joint. Let me stop this here. Okay, so basically, as we get older, these stem cells obviously are declining. And what we define as aging is actually really a function of just having less stem cells. Thankfully, it is this easy. I mean, this is awesome to me because we can fix aging just by wearing a patch. Wow, that's crazy. So we have these senior moments that become normalized, right? Why did I walk into this room? I don't remember. Some people say, oh, a good day is when, and a lucky day is when I walk into the kitchen. I remember when I went in there, ha, 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 ha. And everyone laughed about it. And that normalizes this aging process. Well, why is that happening? Well, the brain's degenerating thanks to all the toxins in the world, and it's not rebuilding. Aches and pains, over the hill. Can you believe over the hills at 40? As you get well over 40, you think, wow, I'm really over the hill. But that's a normalized thing too. Well, we're just going downhill from here, right? And then disease onset being normalized is coming with age. Okay, it does come with age, but we know why, because we don't have the amount of stem cells, available to us that we did when we were younger for this repair. And so what I want to actually go over here briefly here. I'm just going to let you know what we can expect. So when you plop on one of these stem cell patches, in the first 24 hours, 4,000 genes begin to reset in your body. Is that wild? 4,000 genes to a younger, healthier state. And that is because of, the beginning of the stem cell activity. Within a month, the new stem cell army has been activated, and now it can start to go to work on whatever area that is for you. Everyone here right now could raise their hand and tell me what their thing is. Okay, what's their thing? Is it your knee? Do you have headaches? Does your neck hurt? Do you have low back pain? Do you have digestive issues? Okay, so the thing that's your thing, this is going to go to work on first. Within 6 months, the brain starts to come into balance and coherence. This is one of the most enjoyable effects of X39 that people experience. Why? Because we all feel great when our brain's working well, when we don't have brain fog, when we can recall words easily, when we can recall information to share with friends and family easily. If we've suffered from depression and anxiety and we feel that start to lift, all right, if we've had sleep issues and we start sleeping better, these are amazing things in your life. And this is a sign of that brain balancing starting to occur. Now, around the 3-month mark is when we see that increase in collagen. Now, those of you that were on last week saw the presentation on collagen, and I think collagen is amazing, and it's amazing where it is in our body. And so that's when that really starts to be stimulated to increase in the body, and we can start to see changes in our skin. Okay. A lot of people see changes in their skin around that time and oftentimes before. So what does that mean? Our skin's thicker, it's more pliable, it's softer, it's shinier, it's plumpier. Okay, plumpier, I think I just made up a word. At around the 6-month mark of using X39, that's when we start to see these cardiovascular changes. Okay, so what does that mean? Every 6 weeks of use of X39, your heart goes back in age by 8 weeks. And this is cumulative. This is critical right now, you guys. For everyone that has had issues with their heart thanks to COVID. I speak about it every week, but that was me. And for months and months and months now, and I'm 22 months-ish into using the patches now, I have not had one misbeat in my heart palpitation, which I had because my heart did sustain damage from COVID. It has healed my heart. Okay, so anyone that has heart, yes, yay. All right, and then within around that 12-month mark is when you really are able to notice this regeneration. Now, it's very, very important for people starting on the patches, or even if you're 3 months in or 4 months in, or wherever you are, track your progress, because you're going to not realize the little shifts and the little changes. Okay, so I really, really encourage you to use the health tracker when you start this, because it's going to be your friends that say, hey, Marty, what's different about you? I noticed something. And you go, oh, I don't know, because we, kind of attenuate to looking at ourselves in the mirror, and we don't notice the changes anymore. You'll just notice your knees aren't as achy anymore. I had a C-section scar that was very, very thick that I noticed a few months ago. I'm like, oh, I can barely feel that now. Okay, so these things are critical to keep track of. Does anyone have any questions about that so far? Marty, is there anything you'd like to add?
No, I think you covered it. Are you going to discuss how we use them? And did you want me to share my before and after picture?
I would love that. And while you do that, I'm going to grab my patches right here.
Okay. Yeah, I just put my patches on.
So what Marty, this is a great example of what I just referenced. Marty hadn't noticed these changes in her. She had not been on very long on the patches, and it was a colleague of hers that said, hey Marty, have you noticed this about yourself? So this is a great example. Go ahead and speak to this, Marty.
Yeah, so these shots they're actually screenshots from videos that I did while working at we have an essential oil shop in Placerville, California, and the lighting is the same. I know it looks different, but on the first before picture, the lighting on the side of my face, that's the same lighting as I'm facing that light on this other one. But you can see the difference on the the wrinkles on my forehead, around here. I don't know what these lines are called, around your nose and mouth and stuff. Everything has just tightened up, and the wrinkles are way less noticeable. Also on my neck. And yeah, someone was looking at my videos and noticed that. And I was like, wow, I think I need to use that as like an example, right? So that's why I always tell new people when you're getting started take a picture of your face. I know this sounds maybe crazy. Just do a real quick selfie and just put it away and check back. Check back in 90 days. Check back in 6 months. You're going to be surprised, pleasantly surprised about what you find. Also, my hair is growing in thicker and darker. I know, so I'm naturally blonde, but you can see how the darker roots back here growing in. It's like my hair is changing to dirty blonde or light brown, whatever you want to call it. And I'm good with it. I have not dyed my hair in 3 years. So this is my hair color now. And before the patches, it was a lot whiter. I know that one picture that I showed, I actually had some touch-up stuff under here. You know, you can have that little root touch-up stuff. I don't use that anymore. So my roots, and I like it that my roots are coming in darker. Sun just does its thing with your hair, you know, during summer and whatever, lightens it up, put some streaks in it. So that's another thing that you can look forward to. And just understand that if you're seeing visible results on the outside, you just know that things are getting fixed on the inside, because your body's going to prioritize what it fixes. It's going to go to the things that are going to keep you alive first, like what Jen was talking about. Your heart's a little bit more important to your overall being than some wrinkles around your eyes, right? So just understand that that's what's going to happen first. Your body is very intelligent. It's going to put those stem cells that are reactivated back to work and start fixing whatever you got going on.
Yeah, I love that. And I'd like to speak to that as well. My mother, who's 77, and she had kind of, it's okay for me to say this because it's pretty now, so, but she had that kind of yellowy gray hair. Wasn't that really pretty silver color? And so in the last 6 to 8 months, she's been on them for about 20 months. Her hair has been starting to turn this beautiful silver color. And now in the back of it, like Marty was speaking of, it's growing in dark. So it's this really neat salt and pepper. It's beautiful. So this, I mean, people pay to have that done. And personally, my hair started to really grow in thicker, stop falling out and all of that just about after the time my heart symptoms started to resolve. So that speaks to the fact that my body's like, you know, yeah, we know your hair thinned out a lot over the last 10 years, but we're going to take care of your heart first. And we just kind of keep you here. Then we'll make your hair pretty. And seriously, my hair is double the thickness that it was when 10 years ago, you know, 45. So it's a thing. So that's kind of fun. I mean, I'm happy my heart's, you know, getting healed, but I'm really happy about my hair too. Okay, so Marty wanted me to talk about, you know, use of these patches. So this is what I wanted to have near me earlier, but this is the one of the patches. This is actually glutathione because I'm going to put it right here on my chest. This is where I wear it, but the X39 goes on the back of my neck. So basically all you do is you peel it off, okay, place it on the skin where you want to put it. You can wear them most anywhere. There are specific acupuncture pressure points and the meridians in the body that the research is done on, and that's why those placements are in the booklets that come with it. I particularly like to put glutathione right here. It's very protective of the immune system. I see Monica's got hers. The highest concentration of glutathione in our body is in our lungs. So I kind of want it here at my lungs. I'm going to wear this today until 10:25 p.m. approximately because we wear these for 12 hours on and 12 hours off. And sometimes you go a little over, sometimes you go under. It doesn't matter. You just don't want days and days and days of wearing it too long, so your body starts to ignore it. It is critical that you're drinking a lot of water all day, at least half your weight in water, but do not gulp it all down at one time. Okay, you want to drink your water averaging about 5-ish, 6-ish sips every 30 minutes throughout the day. This is a practice you kind of get in a habit. If you gulp it all at one time, you're only going to utilize 5 or 6 ounces and move that water into your cells, and guess where the rest of that's going to go? Okay, right into the plumbing. Okay, and then you're thinking, I drink so much water, but I'm so dehydrated. This is why. Okay, so you gotta just titrate a little bit. That's why, you know, in the hospital, when we're programming our IV drips, we're not running it in, you know, sometimes in an emergency, yes, we're going to do that. But over 24 hours, we're having it drip, drip, drip. Why? Because we want it to be absorbed. Also, you want to add your sea salt. don't know if you can see this. This is the one so far we found to be pretty good. Can you see this? Eden.
Yeah, we
Eden
can
sea
see it.
salt. And then you want to, I just stick my finger in it and dip my finger like the old days of Tang and Kool-Aid baggies, and then put it on my tongue and drink it. And when you do it that way, it actually helps move the magnesium into the cells. It hydrates a little bit better. You guys, we need healthy sea salt. We've been extremely misled about salt. Okay. So up to, I've heard people suggest up to about 3,500 milligrams a day. I wouldn't just start that overnight. Work your way up. But this is not Morton's salt that's in the little blue tub. Okay, that's not good. We want a high quality Celtic sea salt is the best one. Let me just tell you, you go to the doctor and they tell you, oh my gosh, you've got to reduce your salt intake. Because your blood pressure is going up. Well, most of the time the blood pressure is going up because you don't have enough salt. Okay, healthy salt. And just to drive it home right now, in an emergency setting in the hospital, when patients come in to us, back when I was in the hospital setting, what's the very first thing I did? Someone knows here.
Gave him an IV of saline,
I
salt.
started a saline IV, right? Because I need to get some homeostasis going in their body. So just chew on that for a little bit. Okay. Unless there's anything else on that, our educational piece of the week is, I wish I've been holding my breath, is on breathing. So I'm just going to do a quick little piece on that. And I'd like to do something more on that someday. And I'm going to breathe right now because we don't breathe properly when we're talking. Okay. Are we ready for that? Is there anything that needs to be answered in the chat, Marty? I see there's stuff.
No, Monica mentioned she uses Baja Gold, so that's one of them that you can use. So I have Baja Gold, the Eden sea salt that Jen showed, and the other Celtic sea salt in the bag with the blue label. Can't think of what the name is. You might want to rotate them, and be aware, because you may have seen some posts. People are saying, "Oh, there's super high heavy metals in some of these sea salts, and you got to watch it." So just be aware of it. And I think it's good to, because we're talking about detox right now, and Jen's going to talk about breathing and detoxifying. We don't normally associate breathing with detoxifying our bodies, but there's other things that we do also. So we're going to talk a little bit about that as well. Go ahead.
I also think those of you that have worked with Marty and I, we all teach you how to muscle test, or we teach you all how to muscle test. So I think it's very important, just like with anything else, that you muscle test the salt you're using and find out if that's good for your body, because things can be different for everybody. Okay, so whatever salt you have, ask, is this good for me, and see what you get. And you'd be surprised. Sometimes you think it's good for you, and then we mix it up. Okay, so I recommend that. I'm gonna hop over here to my PowerPoint. And gonna share that.
Okay, we can see it. Excellent.
Yay. Okay. I need this screen to go way up here so I can actually make my slideshow. But you know what? Maybe, can I get it right there? This is why Marty's gonna learn how to edit videos.
Yeah,